A lot of my interest in orthopedics and sports medicine and treating sports injuries and sports surgery really comes from how important physical activity is to me personally. I've been active all my life, and that started playing multiple sports growing up. Soccer, actually as a little kid I was more of a baseball player, and then that kind of delved into soccer, played some basketball through junior high. In high school I played soccer 4 years and ran track, and then when I got to college, picked up lightweight crew, having never rowed before. But at Harvard, the lightweights in particular go out and recruit athletes who've been involved in other sports because they realize that a lot of people haven't been exposed to rowing in high school, and was fortunate to train and compete there for 2 years. I was not the star athlete. The first varsity lightweight boat when I was a freshman won nationals and went to Henley and competed in England. But training day in and day out for 2 years with people that were future national and international level athletes, Olympians, et cetera, really gave me a good sense of how to sort of push my own boundaries. And then after I stopped rowing, one of my teammates got me into running marathons, and we ran the Boston Marathon together, and then I ran it my senior year and set my personal best time of 2 hours and 45 minutes. And even though I don't run those distances anymore, I do still get up before work and try to knock out a run or push a baby jogger around on weekends. And more recently have gotten into the craze that is Peloton. But that physical activity is so important. It really helps prevent a lot of long-term illnesses, helps manage blood pressure, stress, heart disease risk, all those types of things. And so one of my real goals in my practice is to help people stay active and kind of be safe and healthy doing the activities that are important to them.